Hi, my name is Dr. Lexie Wang. I am a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today on Face the Facts, we're going to talk a little bit about facelifts, and this is going to be part one of that discussion. I'm first going to begin with what do some of these terms even mean, because I know it's very confusing. So today we'll talk about skin versus traditional / SMAS style versus deep plain facelift and what these all things mean, and then another episode we'll talk about some other things. Okay, so first, do you remember way back in elementary school the word plane was some kind of like flat sheet? We learned that in geometry. So a plane, as it is in geometry, is the exact same thing in the face. The face, we have several layers, or planes as you will. We've got the skin layer. Right under the skin there is a little bit of layer of fat, but usually that's lumped into the same layer. Then we have this layer called the SMAS, which stands for Superficial Musculo-Aponeurotic System, also known as SMAS. The SMAS contains, it's a true layer that contains and envelops and wraps around a bunch of different muscles of your face. And then under that, we have some deeper tissues, which I'm not really gonna discuss because that's not very relevant for the discussion. So these are distinct layers of the face, and different layers can be lifted differently. So let's go into the different common styles of facelifts that you hear. The first one is very, very old school style of skin only facelifts. This is what we tend to say is like first style facelift that ever came around. I don't think many people are doing this kind of facelift anymore, but basically all you do with that one is you just stretch the skin back and cut out the excess. This is what gives that kind of windswept appearance, which is not very realistic and kind of looks fake. And then most importantly, it does only last for maybe a couple of years because unfortunately we continue to sag and age, and so that skin laxity is going to come back and you're going to have to get another surgery. So I don't think it's very commonly done anymore, but that's the skin only kind. It's important for you to know that because we now know that that's a problem, and that's why we don't do this kind of facelift anymore. Now, the next two styles are the traditional SMAS type lift versus this whole deep plane lift, okay? The main difference between these two is, again, what is being elevated. In the traditional type of facelift, there is usually some elevation of the skin, meaning the skin is kind of repositioned in whatever direction the surgeon desires. Then there is also some degree of repositioning of the deeper layer, the SMAS plane. So you can kind of lift the skin, for example, this way. Maybe you want to lift the SMAS layer this way. It can be a bunch of different things. It's a lot smaller of a dissection than a deep plane facelift, and it is bigger of a dissection though than a skin-only facelift. And so this is still very commonly done throughout the country, and it's a good facelift. The other kind of facelift that we kind of tend to do here is called a deep plane style facelift. And again, the word plane, I want you to remember, so the deep plane means below the SMAS layer now. So now we are actually dissecting under the SMAS to those deeper tissues that I was telling you about that live there. And then we will separate some of the ligaments there that kind of tether all the SMAS and the muscles and all that. And then that allows us to lift the SMAS, and we actually leave the skin attached to the SMAS. So you're not lifting the skin and the SMAS separately. It's just the deep plane is getting lifted. So that's the difference between the deep plane one versus a traditional one where you are lifting both skin and SMAS just in kind of different orientations. They are separated. Which one is better? Better is kind of in the eye of the beholder in terms of what you need, what the surgeon wants to do, etc. Some factors to consider might be the time of recovery, the level of dissection, you know, the expertise of the surgeon. Have you had other procedures done on your face before? Do you have implants in your face? Things like that. So make sure you talk to your surgeon about what style of facelift you're getting so that way you know what you're getting into. In conclusion, on today's episode of Face the Facts, we talked about different kinds of facelifts. My name is Dr. Lexie Wang. I am a facial plastic surgeon at West End Plastic Surgery in Washington, D.C., and I look forward to seeing you on part 2.